Having a furry friend diagnosed with canine lymphoma can be overwhelming. You're not alone in this, and we're here to guide you through it. So let's start by understanding what canine lymphoma is. Canine lymphoma is a type of cancer that affects a dog's lymphocytes, which are an integral part of the immune system. It's a common disease in dogs, but the good news is that it's usually not painful for our four-legged friends. There are several types of canine lymphoma, each affecting different parts of the dog's body. The most common type is multicentric lymphoma, which affects the lymph nodes. Other types include alimentary lymphoma, affecting the intestines, mediastinal lymphoma, impacting the lymph nodes in the chest, and extranodal lymphoma, which can affect any part of the body, including the skin, eyes, and central nervous system. Each type of lymphoma behaves a bit differently, but generally they all interfere with the dog's immune system's normal function, making them more susceptible to infections. But remember, our canine companions are resilient, and most dogs with lymphoma continue to live happy, comfortable lives during treatment. The impact of lymphoma on a dog's life can vary widely. Some dogs might seem perfectly healthy, while others may show signs like decreased appetite, weight loss, and lethargy. But these symptoms don't necessarily mean your dog is in pain. They are the body's way of responding to the changes happening within. Understanding canine lymphoma is the first step in navigating this journey with your pet. With this knowledge, you can better comprehend what's happening inside your dog's body and make informed decisions about their care. Remember, you are your pet's best advocate, and your understanding and actions can significantly influence their quality of life. It's essential to understand the disease to make informed decisions about your pet's health. Let's dive deeper into how it's diagnosed. Early detection is key in managing any condition, and canine lymphoma is no different. The symptoms of canine lymphoma can be subtle or easily mistaken for other less serious conditions. They may include loss of appetite, weight loss, lethargy, and swelling in the lymph nodes. As these symptoms are quite common in various conditions, it's crucial to consult with a vet who can ascertain the root cause. Diagnostic tests for canine lymphoma typically involve a physical examination, blood tests, and a biopsy of the enlarged lymph node. The physical examination allows the vet to feel for swollen lymph nodes, while blood tests can identify any abnormalities in the blood cell count. The biopsy, however, is the most definitive diagnostic tool. It involves removing a small sample of tissue from the lymph node and examining it under a microscope. The importance of regular vet visits cannot be overstated. Regular checkups allow your vet to monitor your pet's health over time and quickly spot any changes. This proactive approach can lead to early detection, which significantly improves the chance of successfully managing the condition. However, it's important to remember that the diagnosis of canine lymphoma is not a death sentence. Significant advancements have been made in veterinary medicine, providing a multitude of treatment options. With appropriate treatment, many dogs can enjoy a good quality of life for months or even years after diagnosis. Moreover, canine lymphoma is usually not painful for dogs. While it can cause discomfort due to enlarged lymph nodes, this is typically manageable with medication. Dogs with lymphoma generally maintain a good appetite and are active and happy. A confirmed diagnosis might feel like a punch in the gut, but remember, knowledge is power. With this information, you can explore the best treatment options for your pet. After all, our furry friends rely on us to make the best decisions for their health and well-being. And with the right care and love, they can continue to bring joy into our lives, even as they bravely face this health challenge. With a diagnosis of canine lymphoma, it's crucial to weigh the treatment options carefully. Canine lymphoma is a complex condition, but thankfully, we have several treatment paths to consider. The choice of treatment often depends on a few key factors: the overall health status of your pet, your personal preference as an owner, and of course, your vet's recommendation. One of the most common treatment routes is chemotherapy. This involves the use of powerful drugs designed to kill cancer cells. The type of chemotherapy and the duration of treatment will vary based on the specifics of your pet's condition. Here's something that might surprise you. Chemotherapy in dogs is typically less intense than in humans, meaning side effects are often milder. Another option is radiation therapy, which uses high-energy rays to destroy cancer cells. This treatment is generally reserved for localized lymphoma, and it's often used in conjunction with chemotherapy. Alternatively, there are natural remedies. Some pet owners choose to complement traditional treatments with natural approaches. These can include dietary changes, herbal supplements, and alternative therapies like acupuncture. Bear in mind, each treatment option has its own set of pros and cons. Chemotherapy, for instance, can be effective at slowing the disease's progression, but it can also have side effects like nausea and fatigue. Radiation therapy can target specific areas but may come with risks like skin irritation. Natural remedies, while they may improve overall well-being and boost the immune system, are not typically able to halt the disease on their own. Regardless of the treatment path you choose, regular checkups with your vet are crucial. They'll monitor the progression of the disease and adjust the treatment plan as necessary. It's important to remember that there's no one-size-fits-all solution. What works best for one dog might not be the best option for another. The goal is to find a treatment plan that offers your pet the highest quality of life possible. Treatment decisions can be challenging, but they can also significantly improve your pet's quality of life. As we navigate the journey of canine lymphoma together, remember that each decision you make is a step towards ensuring your pet's comfort and happiness. Living with a pet diagnosed with canine lymphoma can be an emotional journey. But remember, the prognosis isn't a deadline. Canine lymphoma, like many diseases, has a prognosis that can vary greatly. It depends on a myriad of factors, including the type of lymphoma, the stage of the disease at diagnosis, and the overall health of your furry friend. Some types of lymphoma are more aggressive and progress rapidly, while others are slower and more insidious. It's crucial to remember that each case is unique and that your pet's prognosis is not set in stone. A prognosis is an educated guess based on statistics. It doesn't account for individual differences, the strength of your pet's spirit, or the power of modern medicine. There are real-life stories of pets defying the odds and living far beyond their initial prognosis. Like the tale of a little terrier who, after being diagnosed with an aggressive form of lymphoma, was given just a few months to live. But with the right treatment and an abundance of love and care, she's still wagging her tail and enjoying life 3.5 years later. These stories serve as a beacon of hope, a reminder that sometimes miracles do happen. However, it's not just about the length of life, but also its quality. Even with a diagnosis of lymphoma, many dogs continue to lead happy, active lives. Canine lymphoma is usually not a painful condition, and many dogs do not feel sick, even though they may have a serious illness. Your role as a pet parent is to ensure that their remaining time, whether it's months or years, is filled with as much joy and comfort as possible. This means regular checkups with your vet, following the prescribed treatment plan, and making sure your pet is eating well and getting plenty of exercise. Above all, it means providing a loving, stress-free environment for your pet. Your love and care can make a world of difference in their quality of life. In spite of the prognosis, there's always hope, and most importantly, your pet can still enjoy a good quality of life. Your pet's diagnosis doesn't change the love and bond you share. It's about making the best of the time you have together. In the wake of a diagnosis like canine lymphoma, it's crucial to focus on quality time and ensuring your pet's comfort. So, how can you make the best of this time? Here are a few suggestions. First, managing their symptoms is paramount. Consult with your vet regularly and ensure your pet is as comfortable as possible. This might involve medication for pain relief or simply extra soft bedding for rest. Remember, you know your pet best, so if something doesn't seem right, trust your instincts and seek advice. Next, engage in activities your pet still enjoys. A gentle walk in the park, a relaxed game of fetch, or even just snuggling on the couch. These moments of joy can do wonders for their spirits, and yours too. Nutrition is also vital. A balanced diet can support their health and energy levels. Treats are okay, but remember to keep them healthy. And of course, always share them with love. Importantly, don't forget mental and emotional support. Pets, especially dogs, are incredibly attuned to our emotions. They need reassurance and love just as much as we do. Speak to them softly, stroke them gently, and show them that they're not alone in this journey. And of course, capture these moments. Take pictures, shoot videos, make paw prints. These keepsakes will not only bring joy to your pet, but will also serve as precious memories for you in the future. Lastly, self-care is crucial for you too. It's okay to feel overwhelmed. Reach out to supportive communities, friends, or a counselor. You don't have to go through this alone. Remember, you're not just a pet owner, you're their family. And in this journey, you're their greatest comfort and strength.